Everyone. Welcome to today's edition of Shagalinku. My name is Master Emmanuel. It's good to be here with. We're streaming live from the city of Kaduna. So I hope the network will be Kaduna. Please be good to us. Every time I come to Kaduna and we need to do Shagalinku, my heart is always bumping and beat and we pray and hope that the network will just let us do this for the next 45 minutes or thereabout. Okay, for those of you who've seen our flyers, you know what we're talking about. We're looking at COVID-19 and how it also relates to gender-based violence. During the lockdown, we had international tell us about the shadow pandemic, which included rape, gender-based violence, and all of other things. Let me also say thanks to Connexus, who have helped us a couple times, and we're running a project. We're talking with young people on COVID-19. Connexus sponsored the project last week. A 3-day training on COVID-19 awareness and safety measures that we did for 40 young persons from 15 local governments. It is amazing, and thanks to everyone who joined. Thanks to all our facilitators and speakers and guests joined us from across the world. We truly are grateful. Let me use this opportunity to do all that before we go on into the program. Okay, we're streaming live in 2 destinations, or rather 3. Shagalinku TV Facebook page, Shagalinku TV YouTube page, and then my personal page, Ambassador Emmanuel Gabari. These are the 3 channels. Please do share this video or the link if you're watching us right now. Okay, I'll bring in my guests. We're supposed to have 2 guests, but one is on transit, and I have one. Hi, Babatunde. How are you?
Yeah, I'm fine. Good afternoon. How are you doing?
Well, so I know we've been trying to have a while now, but to have you here at last. So welcome to Shagalinku. How are you doing?
I'm very fine, thank you. How are you doing too?
I'm good. So for timers who are watching today, what do you do? Are there current programs you're running that you think our viewers across the world should know? And then we'll go about our topic of discussion.
Oh, thank you very much. My name is Babatunde Oladipupo. I'm the principal counselor of I Klinique. I Klinique is a counseling-based firm where we help individuals who are going through issues of trauma, sexual issues, marital issues, and those who are having issues with choosing their career. So we help them to be able to discover themselves and to be able to solve whichever issue that is affecting them. And at times we try to help them by doing referral where there's need for it. So that's basic things that we do at I Klinique. Thank you
very much for that little background. I know we'll still be talking about I Klinique as the program progresses, but for our viewers, you've heard from our guests, and go on. So please, if you're watching right now, do let us know where you're watching us from, and the comment section is just under. Drop your comments or questions you have for our guest, and he will be responding to them. Eventually get Elizabeth Talatu to join us later on in the show. She will also join us. She's actually transiting from Lagos to Abuja, but as soon as gets settled before the program finishes, we'll let her join us. But for now, let me bring in my guests to talk more. So please do share the video, and then like the well and drop your comments, like I said. Okay, Baba. We all saw what COVID-19 did. It dealt a hard blow on virtually all spheres of me. All spheres of it. Whether education, ASU was on strike already and joined, so you were at home, couldn't go to school. Whether it's and when it's business now, it's not just self-employed. Of cross, even federal government parastatals had to go on recess for a while. Now, what was it like for us as Nigerians? Did you think, or do you think we planned as a country, guide against the COVID-19 before we even go to the pandemics, the lockdowns, and all of that? Did we see COVID-19?
Thank you very much. You see, the issue of COVID-19, we're not prepared for it. And not just Nigeria, virtually all the nations all over the world, we're not prepared for it because we were never thinking we could have such issues all over the world. You know, you can imagine for someone like me, for the first time, ever since I was born, that was the first time I will experience a particular thing that could affect the old world. We usually do have issues that are geographically based. You know, we have issues peculiar to to the North America, South America. We have issues peculiar with the Asian, and we have some peculiar with African nations. But at this time, we have this issue of COVID-19 affecting the whole world. No nation was ready, and even when it came, they were all confused. Everybody was confused. Everybody got confused about it. And as a nation in Nigeria as well, we had our own base issues. We had issues peculiar with Nigeria, and then now coupled with COVID-19, it's sad, it's unfortunate, but we are glad we were able to get along. Well, whatever the what's it called? What people thought could happen will happen in Nigeria. We're thinking that we'll have high number of victims or death, to record high rate of death in Nigeria. But unfortunately, we never had it the way it happened in some other nations, like in the United States, India, Turkey, or Brazil. And that actually shocked the other nations, the global leaders, you know. And there's a report recently that in Nigeria was the fourth best nation in response that responded so well to COVID-19. And I want to give it to our government if that they really try to be able to curb it, even though we expected them to have done more. But at least in the little way they have done, we should as well commend them for that. Thank you.
Yeah.
That's for now.
Yeah, and we must also give it to the Lagos State government, and the governor. They were all at it during the first major case that came in, all through, and it come to one. So thank you so much. Yeah. So let's come back to the pandemic. Were you worried at some point, even before they came, other countries had gone on lockdown, So Nigeria was like sitting for so long, and then movements were already on flights were already into the country and going out. And same thing happened, with the Delta variant, because it was on few countries discovered that they were closing their airports, and it seemed like we didn't believe in that, or we were still slow the way we were for the mix. So just in these two scenarios where it took us a while to do the lockdown when all countries had started, and then the Delta variant. Do you think we learned anything from all of this?
You see, in Nigeria, we have many issues in Nigeria. Like when the issue of COVID came in, even the citizens found it difficult to believe. A lot of people did not even believe it, that there was anything like COVID. But to some of us, we were kind of scared, especially for someone like me. I was monitoring, trying to check on the data of the death rate of different nations. That was enough to send fear to people, but not just to send fear to us, to also make us to be cautious to know what we needed to do. But unfortunately, so many people were just carefree. Why? Because of the issue of corruption in Nigeria. So they thought, well, probably the government were lying. And though there were cases that seems as if there were a lot of lies, but despite that, we saw what other nations were facing. We as well will have, tried as much as possible to be cautious, to do the right thing, whereby we're asked to be careful how close we were to people around us, putting on our face masks, washing our hands, sanitizing our hands, and be very mindful where we go to. We were never prepared for it. We were never prepared for it. But when it came, unfortunately, even up to now, some people still don't believe that there's anything like COVID. No. And now that there's another new variant, the Delta variant, that is spreading around, and Nigerian government even have decided that there is not going to be any form of lockdown in Nigeria. Despite that, we individuals still need to be very careful. We need to watch it wherever we go to, try as much as possible to take precautions. And we all know what to do, even with or without COVID. We don't need anybody to tell us to wash our hands regularly. We don't need anybody to tell us to be careful of what with breathing and how we get close to people. Unfortunately, Nigerians, we are social people. We are highly social. You want to greet someone, you have to hug the person, you have to shake the person, you want to show affection by action. All these things, trying to limit it, it goes a long way. It will go a long way. So it will take God to help us. And there's another thing. There's another thing that is a big issue for me. Is the issue of sensitizing the people. Orientation. No matter what the government must have done, they've not done enough. The agency that's supposed to be responsible for these giving out information, we still need to do more, help people in various languages, though they've done that. But not just the government. We need some other stakeholders. We need faith-based institutions. We need our other sectors to also help. Help people. Sometimes people need to be forced to do something, to do the right thing. If it will need to get to that, why not? Because how would it look like for me to lose my loved one, for anyone to lose their loved one? We don't want to experience that. And in Nigeria, the things that kill people mostly in Nigeria, there are things that will easily be avoided. What costs just a little amount of money to resolve is what is killing people in Nigeria. So, and negligence, that's
Yeah. Thank you very much. So, in case you just joined us, this is Tuesday's edition of Shagalinku TV, and we're talking with my guest, Mr. Babatunde from Lagos. Elif will be joining us shortly, but for now, we'll just hear Babatunde. If you have comments, please drop them on the comment section. Do share the video, share the link of the video so that others. I got feedbacks here from Renny Mwenda from Kenya, and she said the sound, there seems to be an echo. Okay, so I saw this. I've had to put my earpiece. I hope this works. And Oluwasegun Samuel also said the sound is not good. Okay, so I'm here with my earpiece, and my guest is also with his earpiece. I hope the sound is better now. Thanks for the feedback. Since we can't all know the feedback until you guys let us know. Elizabeth, so I'll let her come in and introduce herself, and then I will back. Babatunde. Elizabeth, how are you doing? Hello, Elizabeth. Are you there? Can you hear me? Okay. Babatunde, can you hear me? So that
yes, I can hear you. Yes.
Okay, fine. We could continue, and then Elizabeth joins. Elizabeth, you have to unmute your mic so that you can join us. Anyway, when she joins and do all that. So let's come back, and it's a good thing. Good talked about the Delta variant. So what were some of the things as shadow pandemic that organizations or international bodies talked about? I am sure there were so much happening, behind the scene that were unreported. For me, it was just beyond just the pandemic, the shadow pandemic of maybe rape, gender-based violence, and all that. My concern more that I noticed while on the field during the lockdown was how people weren't able to access medical care. Up until when NGOs started screaming and shouting, you found pregnant women who couldn't one get easier transport to locations of healthcare. We found people who were violated, their human rights violated by security agents. Maybe they get to a bus stop or a checkpoint, and the security agents will tell them, go back to your house. Even when they say there's an emergency in the hospital, you need to go take care of them, they still insist and tell the person, go back to where you're from. Do you want us to shoot you? So aside the pandemic, the shadow pandemic, what do you think were also there that we put in report?
Not that there were not reports. There were a lot of reports, but probably not everything not everything was
on the media.
On the media, just like that. Like there's a particular state in the eastern part of Nigeria. It was recorded that during the pandemic, about 80 cases, 80 reported there were 80 reported cases of fathers abusing their daughters. Sometimes it's not always a good thing, sharing bad news, but we just have to we need to be aware of this. And there's a report that says 1 out of 3 women in Nigeria have experienced physical or sexual violence. And this is a serious issue. It's a serious issue that really needs to be addressed. And unfortunately, many things happened, especially gender-based violence. Many issues took place within that lockdown and even after. But unfortunately, the government, I still always, it's so sad that I still will always refer back to that the government is not properly prepared or just negligent on issues like that. Are you there?
Yes, I am.
So, okay.
Yes, I am.
All right. So we have quite a number of issues recorded during that lockdown and even after the lockdown. But unfortunately, because maybe the culprits were not put to book and victims were not properly taken care of, there were not easy access to medicals, and we're looking for deep, what's it called? More evidences. And what about the cases where we couldn't have good evidences? What happens to the victims? And then we have issues of stigmatization. When there are issues of rape and the person is trying to avoid being stigmatized in the society. So many women would rather keep quiet. And we have, there was a particular research by a study recently commissioned by the Ministry of Women Affairs and Social Development in conjunction with United Nations Population Fund. It was stated that 28% of Nigerian women between the ages of 25 and 29 had been abused. You can imagine with that number of women being abused, and unfortunately, when so many of them will rather prefer to be quiet than being stigmatized. So you see, there are quite a number of terrible issues on ground that the government will really need to look into. because we need more policies at the national level. We need policy from the National Assembly, government policies that will help to protect women on the issue of gender-based violence. But mind you, we talked so much more on women, but what about some men also? We have men who are also being violated. And because men would rather prefer to be strong and pretend as if nothing happens to them. And so many men dies, and unfortunately, that is why we are having high rate of depression. So many of them dying, and because they are depressed, nobody to talk to, nobody to help them through the issues they are going through. So we just need help. Maybe that's the way. That's why we need professional counselors to assist people. You understand?
Yeah.
Maybe when the government will need to equip more counselors, equip more the medical, the health sectors, whereby providing the basic needs. And sometimes we depend too much on the government. During the COVID-19 issue, we discovered that the private sectors had to come together to help the government, especially in Lagos State, and they made provision of so many of the medical facilities. It shouldn't be because of COVID alone. We should have more of it. What happens to the CSR? The CSR shouldn't just be giving money, free money to people. The free money we want to give to people, can we make it to put up structures? We should look at what we individual persons can as well, or individual organization or faith-based organization can as well help the government to put in place, especially the health sectors, all hospitals. Like for example, in some villages, they have to travel miles to be able to have access to basic medical facilities, and it's so sad in this dispensation. In this century, we shouldn't be having such problems anymore, and we can do better. And I believe we have men who are capable, who could help out, and we need to, if there is need for us to plead to them to kindly please help the nation, help the citizen of Nigeria to make all these available. It will go a long way. And you can imagine we have in Lagos State, for example, Lagos State is trying their best, but and we have it too, they are overstretched because there's a lot of migration from other states to Lagos State. So because of those facilities being overstretched, definitely is going to wear out in just a short time. And other governors, what are they doing? And they have allocation every now and then. I don't want to blame anybody, but notwithstanding.
True. Okay, let's see if we could have Elizabeth back again. Elizabeth, if you can hear us, would like you to unmute your mic and do a small introduction, and then we'll pick it up from there. I don't know, we've been trying to reach her. So please, Elizabeth, just unmute your mic and say something to everyone, and then we take it up from there. But let me come back to you, Babatunde. What could be the cause for the shadow pandemic? You've mentioned also that aside the rape issues and all of that there was a research too that in a particular zone, fathers were sleeping with their daughters. So what could have been that spike? What could have encouraged that spike? I know people will say the lockdown gave opportunity for both the perpetrator and the victim to be in the same space, unlike when in the mornings everyone will go out and all of that. But were there other contributions that we may not know of?
Number one is idleness. That's one of the things I see. Idleness. When a man is idle, all sorts of evil could take place in the heart of such men. So idleness. Lockdown made so many people to get idle. They had nothing to do. So definitely, what would you expect? There's a saying, there's a statement. I quote the Bible, says, "An idle mind is a devil's workshop." So I think idleness took over so many, and unfortunately, and they wanted their hands were soiled in things they were not supposed to do. So those were part of the factors that caused those things. And unfortunately, while staying at home doing nothing, we have we could as well have used that period to improve ourselves in some other things that we could do at home. For example, we have one very useless organization agency in Nigeria. I'm so sorry. It's called National Orientation Agency. I don't even see what they're doing. I can't even feel them. I can't feel them at all. They are supposed to have been able to, sensitize the people on how they can make the best of that time. We have some people that even at that period of lockdown, they made some money, despite the fact that they were at home. You know, where COVID is like eye opener. You don't necessarily need to be at work to work. You can work from home, and there are other things you could do from home. You understand? So I think National Orientation Agency should have been able to sensitize people on that, and that's what I think. That's my thought. That's my opinion on that issue.
Yeah. Okay. So let's come back to what victims could have done better. I like the fact where you talked earlier on people who are victimized or people who go through situations of violence hardly can speak out because of stigma. Now, what are some of the reasons that makes victims not want to come out? From some of our research or from some of our interviews with victims, they tell us also that the procedure to even report some of these things are herculean. A girl is raped right now, and you are telling her she has to, with that blood stain and everything. For instance, she's in a remote village of like 2 hours drive. She has to drive that long to the town, to a police station, to where she can get help. So as far as we know, not all states have this sexual assault referral centers yet. And we're still saying that government should find a way of partnering even with private hospitals, so you don't have to drive that long. So lots of victims, aside stigma, still say that the way of reporting these cases are too herculean and dehumanizing, sort of. I mean, a girl is with blood and all of that, and you are insane that until she goes to the police station to get a report, and then until she sees a doctor and all of that. And it's shameful, so to say. So what are the things victims or people can start doing differently while we wait for laws and policies to be in place to checkmate perpetrators?
Okay, thank you. Can I tell you something? When you keep doing the same thing, you expect the same result. You cannot keep
True.
doing the same thing and be expecting different result. No, it's not possible. For the mere fact that the government, there's no good policy, there's no proper policy to back up or to help anybody who have been victimized. For example, in the judicial system, our judicial system is also faulty. When a victim is being uh, is taking the culprit to the court of law. Unfortunately, some of them they are able, because they have money, they are able to skate through. So sometimes the victim could just think within himself or herself that why do I need to just waste my time? So that is why we have a lot of silenced victims, and unfortunately, so many silenced victims end up committing the same crime if care is not taken, if healing have not taken place within them, they themselves will also commit the same crime. No, good enough. The World Health Organization was able to partner with Nigerian government to sensitize the people on the issue of health issue on this gender-based violence. But we see so many of these research work, this partnership on the paper, only on the social media, but we cannot really see the effect. When you're spending money on something, you're making so much research every day, but we can't see the effect of what you're doing. It's more or less useless. And that is why I personally would believe that the first the best thing to do is to try as much as possible to avoid being a victim. Try as much as possible to avoid being a victim. And that will still boil down to the help from what? From the National Orientation Agency, faith-based organizations. What's it called? We have so many stakeholders, including parents, taking proper care, proper what's it called, of their children. For example, can I give you a very funny, strange experience from a particular family? A particular woman who happened to be a career woman. She was so conscious of her job. She would leave the house very early in the morning. Most especially those career men and women in Lagos. You live far away in Ikorodu and you are walking far away in Lekki, or they must. It's very important. They have to leave very early in the morning to go to work, to get to work on time. And unfortunately, it's so late before they get back home. None of them they are not aware of what had happened to their children, and they have little children to train. You can imagine the children have passed through passed through the gate man, passed through the cook, passed through the driver, passed through the class teacher, passed through the school nanny, passed through the home lesson teacher, passed through all sorts of people in the space of 8 hours, even before and after the parent, in everyday experience. This woman is just an example. And one day something happened to her daughter in school, a 13-year-old girl in school, and they called the woman. She refused to pick. The school called her until a text message was sent to her, and they told her that her daughter was bleeding. That was when she picked the call. But what happened to the girl? The girl was pregnant. She had aborted 3 good times for the chef in the house, for the cook in the house, and the uncle. You can imagine, right in the same house where the mother lives, she was not even aware that our daughter had been molested several times. So many parents are careless in proper handling of children. It's not just about providing money for your kids, but building relationships. We rather prefer to build relationship with our lovers or friends and colleagues at work. But what about the children? What about the children that are going to take up our names? You understand? So we need parents to also sensitize our children and also protect them, guide them from falling victim of all this. As a professional counselors, we do say something to our what's it called, client, or probably when we're having training. Like we tell female child, you must be very careful. You don't sit on any man's laps. We tell male child to don't sit on anybody's laps. You understand? Unfortunately, freedom has taken over the whole world. Everybody wants to be free. Everybody wants to have freedom. Freedom to dress anyhow, freedom to take any kind of drug, freedom to go anywhere you like. You understand? But unfortunately, too much freedom itself is a problem. At times, you find yourself somewhere and you see little young boys and girls taking out drugs. And unfortunately, they fall victims of, when the issue comes up, then it becomes a national issue. So the best bet is to avoid it. But if it takes place, the community as well need to also help. The community can come together and state that whoever have done anything of such, be reported to have done this. This is what must be done to the person. All the person hosted and all the person responsible, and take the person to the police to have that way. Unfortunately, even the police, they will tell you they don't even have fun to our issues are just complicated in Nigeria,
So.
Okay, thank you so much. In case you just joined us, this is the Tuesday's edition of Shagaliku TV, and I have my guests here, Babatunde and Elizabeth. I've been trying to bring in Elizabeth to also talk with us. She was on transit for a while, for some hours, and I kind of see her, but can't find a way of joining in. So keep sharing this video. Remember, it will still be here to watch after this show. Viewers who from across the world, in Asia, in Canada, in the US, and all over. So keep your comments coming. Drop them on the comment section. If we're able to read them now, fine. But I guess I will always respond to them even after the show. Today we're looking at COVID-19 and gender-based violence. What we can do differently and all of that. And my guest has been lending his voice to some of the issues we've raised. I'll come back and ask him the role that men have to play in curbing gender-based violence and all of that. But let me also say thanks to Connexus for supporting us in the training of 40 young people, which we did last week and all of that. So Elizabeth seems to be here now. Let me quickly see if I can bring her on. Elizabeth, can you unmute and let's have you talk with us. Hi, Elizabeth.
How are you feeling today?
Hi, Elizabeth. Elizabeth, can you hear me now? Okay. Hi. Okay, we'll come back to Elizabeth. Let me bring in Babatunde back a second time or a third time around. Please, Elizabeth, as soon as you are able to join us, do join us. I really would like you to yeah. So we'll it's heavily here, so I hope you can still hear me. Babatunde, can you?
Yes, I can.
Oh, okay, fine. So maybe the last 2-3 questions I'll be asking, what's really the role of men? I'll come back and ask you a few more on what you do as a counselor in I Klinique. But what do you think is the role of men in stopping gender-based violence? You know, because it's like the patriarchy thing is still happening. Young boys are groomed with the knowledge that they are the almighty and they can't be questioned. So they go with that mindset of the home front to the family setting where they see every female under their domain. And what do you think we can begin to do differently moving forward in stopping gender-based violence?
Yeah, thank you, Manuel. Like I said the other time, that we cannot continue doing the same thing and we're expecting same result. Like we would like, I think the best bet is to have parents to train up their children properly. We should try as much as possible not to segregate and make the boys to be pampered or trained like they are how would I put it? They are the giant in the house. No, every child should be trained the same way. I'll be trained to be to learn how to play their roles very well. Excuse me, like there's something we're trained, we're taught when we're in school. We thought about gender roles. Gender roles. I should be trained to know what I am supposed to be, to grown up to be, in order for me to be responsible. Every child, that's the way every child should be trained. There shouldn't be any form of segregation. A girl child should be trained how to grow up and become a responsible woman. Every boy child should be trained to learn how to grow up to become a responsible man. But when we start making it look like a particular gender is inferior to the other, then there's going to be problem. And unfortunately, like somebody like me, that's why I have issues with gender equality. You know, You know, you taught us about gender roles, and now you're coming up with gender equality. Everybody have their roles to play. You play a role well. When you play it right, you become a responsible person. There shouldn't be any kind of competition anywhere. A young girl, a girl child don't need to compete with a boy child. You know what to do. You do it well. If the mantle falls on you, go ahead and do what you're supposed to do. You understand? So as it still boils down to proper orientation, proper foundation. You know, if you want to have a apple, you know the kind of seed you must plant. So you start from the foundation. If you plant the wrong seed, then you're not going to have the right fruit on it. And unfortunately, it's not just planting the right seed, nurturing. There are times you need to water the plant. There are times the plant will need photosynthesis. There are times the plant will be protected from praise, from a hunt. There are times the plant might need to be protected from other animals or pests. When you nurture that girl child or boy child, at the end, when they become grown up, become the best for themselves and also for the society, and everybody live happily. Not until we have this, we'll still continue to have issues in everyone rather. Yeah. So
Yeah. Yeah.
that's what I
Thank
think.
you very much for that. So, yeah, yeah, thank you so much. Yeah, so we're still on, and we've got a couple of minutes left on the show. Remember, Saturday's election is also coming up, and we're still looking at COVID-19, but we're looking at the new norm and how professionals can begin to leverage on what they can do. But that will be for Saturday, and I might likely just to bring Babatunde to join us on that discussion. So, Babatunde, as we wrap up now, what will be your word of advice to everyone, whether for citizens, whether for the government, whether for people, and all of that? And then also, let me even say this before you wrap up. Do you think our schools are doing enough in terms of gender-based violence? Because a lot of gender-based violence also happens in the educational environment. Yeah, we hear of sex for grade, um, we hear of employment, we hear of this and that. Even as little as just students, have also started doing all that with their teachers. So, do you think there's a lot we also need to do in school? Because come to think of it, some parents still have been able to imbibe and instill discipline in their children, but the missing link comes in from the home to the school. So, what are some of the things we need to begin to ask schools to provide so that we can have a checkmate on that side of the divide?
Yeah, Emmanuel, you see, good enough education is as well. Schools, they know exactly what to do. They know exactly what to do. They are well trained, but unfortunately, they don't. They just want to ignore. And you see, it's very important for them for the school, for example, to instill discipline in their student. While we were growing up, luckily I attended a Catholic school, St. Gregory's College, Ikoyi, and were well trained. Were trained apart from education. We're also trained in the way of the Lord. You understand? So even if anything strange was trying to come to our aid, we still remember the things that were taught. Unfortunately, even though some decide to go the other way. So that's that. And the government, I'll still go back to that. Proper orientation. Then another thing they need to do is good policies, and also judicial system should as well be addressed to be able to undo it when we have a culprit. Are they supposed to be jailed or being fined? If the culprits are being properly dealt with, I'm sure there's tendency to reduce that. And on the issue of corruption, it's not only the government that will need to work on that. Every citizen of the nation also need to try as much as possible to check themselves. It's not just the government. We are all involved. We all should be involved and engaged in the in curbing corruption in Nigeria. You know, for example, when you have a girl child who is using our body to ask for more marks, you know, and unfortunately, some other boy child will be affected negatively as well because he doesn't have anything to offer. You know, it happened while we're in the university, and I'm sure it's still happening. We have some of them. We have some lecturers that were caught, and there are some lecturers that still go scot-free. You understand? And unfortunately, we have some students that are the one that will even request for such. So until we allow discipline in our society, like while we're very young, we used to have some particular subject called moral instruction. We don't have it again in our curriculum. It's unfortunate. I just wonder who the kind of the stakeholders who sat down to redesign
to remove it. Yeah.
To remove it from the curriculum. You know, it's just unfortunate. It's so sad, and we have all sort of issues, delinquencies in our society today. So many of them. You know, issues with drug and drug abuse, issues with sexual what's it called? You know, prostitution, all sort of things. You know, we still have a lot to do. We really have a lot to do. We have a lot to do.
Wow. I wish we could go on and on and on, but I'm trying to respect myself because right now it's raining in Kaduna, and I'm even amazed the network could stay for us this long. So in wrapping up now, what will be your final word of advice to anybody, you know, going through the situation? Because sometimes we talk about gender-based violence and we really don't have a word for the victims. The victims are always on the bottom line of hierarchy of anything, be it even the policy. You know, we're evaluating the bill the other time in Chicago, and we just noticed that there are fines here and there that the perpetrator has to pay to the court and to the government, and we keep asking, what about the ones for the victim herself or himself? You know, there will be trauma, there'll be health issues. A lot of people got infected by HIV/AIDS due to rape. You know, so much will be happening to the victim, and everyone is running up and down for the government, for the this and the that, and victims are rarely taken into cognizance in the issues of all of this. So what would be your word on a final note to victims and then families of victims, and then we'll wrap it up from there?
Let me first of all go address the community and the family. We should try as much as possible to check ourselves on the issue of stigmatization. Anybody who falls victim needs help. Then we need to try to help whoever, any individual, whether the person is close to us or not. Let's try as much as possible to assist. And to the victims, calm down yourself and try to open up. Find somebody you can confide on and speak up. You know, failure to speak out sometimes has affected a lot of people. They bottle up this pain and they have to go through trauma and go through depression to the extent that some have to kill themselves. It doesn't need to get to that. Find someone you can confide in. Like for us at I Klinique, we try as much as possible to help those who are having issues with trauma and those who fell victim of these particular issues of gender-based violence. We have wives, women being beaten up by their husband. Funny enough, I still handled one on Sunday. The lady called me like around 5 a.m. on the Sunday morning, you know, and she was just crying bitterly on the phone. You know, it's good to find somebody you can confide. That's why the fear. She was still able to call me. I had a friend who called all the way from Australia last month. She was shaking on the phone because she was going through depression. The husband did not even raise her hand on her, but with the words, with just mere words, she was abused. You understand? She was just shaking, and we spent up to about an hour on the phone. You know, we have people who go through it and they find it difficult to discuss with someone because of fear. No, it shouldn't be get to that. Find someone you can confide in and speak to. When you speak up, you're on the way to healing. Once you are healed, it becomes a history, becomes the things of the past. A lot of people go through all sorts of things, but without healing, it becomes we have so much men and women with mental health issue on the street. And once this mental health issue becomes too much, do we have facilities to handle it? And we don't even need to get, we don't want it to get to that level. To the extent that we have so many clients being taken to our, what do we call, to our mental health facilities. I know those facilities, yeah, you said? What did you say?
I said referral centers where
yes, and so many,
and
so many of them they have been overstretched. Like the one we have in Yaba, Lagos, is the largest in the whole of West Africa, and it's been overstretched. The one in Naro is also overstretched. So the best bet is to avoid to avoid falling victim, and if eventually you fell victim, find somebody you can talk to. The first thing you need to do, somebody you can talk to confidentially to advise you on the right steps. For example, now, if you know that you are in the state where we have these medical facilities, like somebody who's been raped, you don't need to take your bath. All you need to do is just walk straight to any health center, any probably general hospital or any health center around you. They have kits to use to detect. Once they check, they use that kit on you. That will serve as evidence, and we can go a long way with that. There's always opportunity. It is possible to have a better society by having a positive mindset, change our orientation on how things used to be, and change our orientation thinking that it's still going to get better, and not just sitting down there waiting for the government to do everything, but while we all get involved. For example, someone like me, I just decided that I want to see somebody close to me smile all the time. And that was why I made it possible for during COVID-19. During COVID-19, there were boys, street boys, despite the fact that they were on drugs and drug abuse. I still made food available for them, about 40 boys twice a week, to be able to help them. So in my own little way, and with the help of God and friends, we're able to make provision for these for these young boys, and in order to help them to stay off being violent and also abusing people, one another. So we shouldn't just wait for the government to do this. We should also get ourselves involved and assist the government. So that is why I always call on the private sectors, the faith-based sectors, the faith-based organizations. Though the faith-based are doing excellently well, not just they're doing excellently well, just that they're not publicizing what they're doing, but they're doing so well. But nothing, no matter how much you have done, is still not enough. So God will help us. God will help us.
Amen. Thank you so much, Mr. Babatunde, and thanks to everyone who joined us. I would have, okay, let me take this message quickly. Well done, Ambassador Emmanuel Gabari. This is from Pascal Achunine, all the way from Lagos, Nigeria. Thank you so much, Pascal. It's good to know you joined us. And yes, we streamed live this episode from Kaduna State, where we are currently, and thanks to everyone who joined us. And apologies for those who tried joining us, but network has not been able to do all that for you. It's been raining in Kaduna, so I'm really surprised that network will still let us do a 1 hour program non-stop. Thank you, network, for letting us do all this. Okay, I really want to thank my guests, Babatunde, and Elizabeth couldn't join us. Really don't know why, but it's okay. We'll find another time to bring all of our guests again to talk about it. But do join us on Saturday. We'll be doing COVID series, courtesy Connexus, and we'll be looking at the new norm and what is going on and how professionals can actually also lead the new norm, as it's called. Anyway, thanks to everyone who joined us. My name is Ambassador Emmanuel Gabari, urging you all to stay blessed. And do remember to like all our social media handles, Shagalinku TV, on YouTube, on Instagram, on Twitter, on Facebook, all across board, and on other medias. Yes, on LinkedIn, we're trying to also get that set up, but then just like all our pages, and the videos will still be there. You can watch after the show, drop your comments and all of that. And please remember to click on the notification button. It's very important so that when we go on air, you can join us. And you can share this video right now for everyone to watch. If you're a victim of gender-based violence, help is on the way. And like Babatunde said, reach out to someone. You never can tell. You know, sometimes we just conclude on stigma and say people will stigmatize, and that's why we will not go. But if you check the result, the benefits of reporting or speaking out, it outweighs when you say, oh, if you tell someone, they might laugh at you, or tell another person, and all of that. Anyway, thanks so much, guys, for joining us. Do stay blessed and have a beautiful Tuesday. And thanks to my guest, and thanks to everyone who joined us. And Rennie from Kenya, thank you so much for letting us know about the audio. I hope the audio is better now, but if it's not to worry. We'll try again next week, next episode, that's on Saturday, 2 p.m. West African time. I remain yours sincerely, Ambassador Emmanuel Gabari. Stay blessed and bye-bye.